Good afternoon, and welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stine. I'm a family physician here in Vincennes, Indiana, and Chief Medical Officer of Good Samaritan Physician Network. Joining me today are a couple of our providers through the sports performance facility here at Good Samaritan Hospital. I'll be talking with both Aaron and Matt a little bit today about what that facility is about, what their roles are here in our community, and what services are offered. So kind of to lead off with, Matt, tell us what is this facility and where's it located?
So we are located at 2020 South Clearview Drive here in Vincennes. It's across the street, across Hart Street from Lincoln. And housed within the facility, we have general outpatient physical therapy, occupational therapy, and speech therapy. But then kind of on my side is the sports medicine side. So we have physical therapy over there as well as athletic training, strength and conditioning, and mindset performance coaching as well.
Excellent. So this facility has been there for a while, and you guys have actually been doing this for much longer but have moved to that facility not too terribly long ago.
Yes, we moved about a little over a year ago. We were out there. We were housed here within the orthopedic clinic here at the hospital, but kind of outgrew that area. A lot of people probably know it as Dr. Emmert's old building, so we are in Dr. Emmert's old building. And yes, we've been out there for a little over a year.
Yeah. And so lots of different things that are performed there. I mean, I think everybody kind of has a concept of what physical therapy is and speech therapy and occupational therapy, those types of things. But there's a whole host of other services that you guys offer there beyond that.
Correct. Yes. So like, for instance, myself, I am a physical therapist. So we do physical therapy, but that can be broken down into a couple of different subsects in just your basic insurance physical therapy. So that's, somebody tore their ACL, they had surgery, they're going to come in, they're going to see us for several months, a couple times a week, repeated formal physical therapy. We do that. We also do wellness type services. That's just your everyday athlete, just, hey, my back's hurting me, can you take a look at me? That is a cash-based service. So those are kind of two different versions of our physical therapy as well.
Sure.
On top of the physical therapy, as I mentioned, we have athletic training. So those athletic trainers do see patients out at the clinic, but mostly we're in the schools. So we have contracts with Reveille High School, Reveille Middle and High School, so they're there. We are just starting tomorrow in July. We start a contract with Vincennes University, so we'll provide athletic training services for them. And then this coming school year, we will also start athletic training services with Lincoln High School.
Excellent. And so this is a big time of year for wellness. One thing that really starts getting hot over the next few weeks, of course, are sports physicals. So kids have practice coming up. They have their sporting events starting to come up. That's all heating up. This is sort of an off time right now. So this is an ideal time for people to start thinking about what that's going to look like. And so sports physicals are also going to be offered as well. Aaron, can you tell us a little bit about what that looks like and what services are offered for sports physicals for kids?
Sure. So I'm Erin Sievers. I'm a physician assistant employed through Sports Performance with Good Samaritan. That's kind of where I come into play is sports physicals this time of year. We offered sports physicals in June, had a decent turnout for that. But July 14th is our next upcoming date that we're offering sports screening physicals. So as most people know, if you're going to play a sport in middle school or high school, you have to have your screening exam before you're able to start practice and play, and that's yearly. So this year we're offering physicals for $20, cash pay. You can call the office at
812-885-3011. That'll get you to our phone tree, and then you can select the appropriate number there. I don't know that off the top of my head.
So we'll be doing those physicals, like we said, July 14th. Depending on the demand, it may be just morning, it may be all day, depending on the response out at Clearview at the facility that Matt had spoken about. And within that, like I said, you get your typical exam. So we listen to heart, lungs, ears, nose, and throat, musculoskeletal things, and assess for injury. But then Matt, with the physical therapy side, we're offering what's called the functional movement screen. I'll let him talk a little bit more about that, which is a great service in addition to just your general screening exam.
Yeah, so in general, we want everybody to get a general wellness visit with their provider every year. But one big benefit to this is versus me seeing a child or an adolescent about a normal pre-participation physical is the functional movement screen. So can you tell us a little bit about
Sure.
what that entails
Yes.
and what the benefit of that is?
Yeah, absolutely. So basically the overall goal is to see whether an athlete is at a low or high risk for injury. So it's like you said, a functional movement screen. It looks at movements that any athlete would have to do throughout any competition. 7 different movements that we look at, not only how you move, but also your strength and your flexibility. And then from there, we can parse out if there's any type of asymmetry or if your score indicates there's a certain cutoff point as to whether or not you are at a high risk for injury. And then if if you are at a high risk for injury, we can kind of go from there. Obviously, you're in the right place, because then we can look at some physical therapy or different training things that you need to do in terms of making sure you don't get injured.
So taking that to the next level, which is essentially a corrective action type
Correct.
thing, because I think many times people don't understand that there's a lot to preventing type injuries. Not just if somebody has had an injury in the past, getting fully rehabilitated from a therapy standpoint, but even if you haven't had an injury, trying to identify things that put you at risk for that. Are there specific things that you guys can look at and say, yes, this particular thing puts you at a higher risk?
Absolutely. With every different movement, all 7 of the movements, there are a host of different corrective exercises and things. So myself or another one of our staff members looks at it, says, okay, they got a 1 on this. We need to work on hamstring flexibility, shoulder mobility, and there are a variety of different things that we can do to, like you said, hopefully nip that in the bud before there is an actual injury.
Sure. And then, Aaron, with acute type injuries, as you're functioning as a provider, as an evaluator of these types of things, tell everybody a little bit about how you function in the orthopedic world, the sports
Sure.
medicine type of world, how people get plugged into that. Because I think a lot of times people don't really know if they're a child, an adolescent, an adult, they have a chronic arthritic condition, they have a injury-related condition. They don't really always know where to go. Do I go to the ER? Well, preferably not for these types
Sure.
of injuries. Do they go to the community care? Do they go to their primary care provider? Do they come to you directly? How does that work?
So, easy answer is all the above. I do get a fair amount of referrals from people through the ER. So, if you're injured in a sports related accident, having acute pain, that is always an option or a place to go. And I do get a fair amount of referrals there. But like we said, we don't like to utilize that if we don't have to. So, I do see a fair amount of people who are referred over from the convenient care clinic. Say you're injured on a Saturday or a Sunday in a baseball or softball tournament this time of year. You may go to convenient care, get an x-ray, they assess that there's no fracture. I see a lot of clients like that. So with either joint pain, sprains, strains, just injuries in general that don't typically require surgery, end up kind of in my office, which is located here in the hospital. And then the other form would be too, following up with your family doctor. If you feel like it's something that can wait until Monday, you can be seen on their schedule and they can place a referral and get an appointment with my office. But there's always the option too of calling directly. So say you're just someone who's active as an adult, you feel like you've strained your knee or you've had, oh, I've had this nagging knee pain for a while, maybe I should get that looked at. We'll see direct access patients as well.
Sure. And what a lot of times people don't understand is the options for that. There are many of them, but you want to try to get that not just diagnosed, but then treated and then rehabilitated. And there are a lot of us that are kind of in the weekend warrior, not real athletes,
Sure.
that have the walking wounded type of thing going on throughout the week. And that's something that people can get plugged in through you and then really finish that treatment, that rehabilitation through sports performance. So talk a little bit about what all services. I think people may not understand that you work with a range of ages and a range of conditions. I think probably more than half of my family currently sees you in one capacity or another. But just speaking to that, my children see you in terms of preventative type things, strengthening and athletic training, but then also in terms of people who just want to get more fit, people who personally want to be trained more. Talk a little bit about what those services look like.
Sure, absolutely. So in terms of an age range, I would say our youngest client right now is 7 or 8 probably. And then across all of our services, I think our oldest client is in her 60s. So really a wide range, and that's in terms of training, like strength and conditioning all the way through physical therapy as well. You mentioned the kind of that strength and conditioning that it doesn't necessarily have to be a competitive athlete who's active. She's in middle school, she plays softball. It doesn't have to be that. It could be, one of us, we just want to get a little bit stronger, just feel better about yourself. Absolutely. We define an athlete as anyone who moves. So every move counts is our motto. And if you move, we want to see you move well and move as often as you can. So absolutely, it could be a competitive athlete. It could be somebody who just wants to feel a little bit better about themselves.
And really, you're giving them the tools to continue that training on their own.
Absolutely.
I know that I personally have had a functional movement screen done, and it's an eye-opener. It's something that you don't really appreciate how bad you are until you fall over during the functional movement screen, and then you guys go, yeah, this is what we're talking about. But flexibility, strengthening, certainly core strengthening, because a lot of what we deal with in primary care is people who have chronic low back pain and chronic osteoarthritic type conditions. And some of the things that you can offer really help to address not just symptomatic relief of that, but prevention of future problems with that as well. Like low back pain is obviously certainly a common one.
Sure. Yeah, absolutely. We sometimes refer to it as kind of prehab. You see somebody before where they can get injured. So yeah, if we can absolutely look at those deficits from the functional movement screen, or just from just seeing different things in physical therapy evaluation in general, and see, maybe you hurt your shoulder playing catch with one of your daughters, but we're looking at you move, and we're like, well, we don't really like how that hip moves. Then we really try to look at kind of a holistic approach of look at the whole body and make sure, yes, we're going to address that shoulder, but we don't want you back in 3 months because you were squatting down to play catch with your daughter and you hurt your hip.
Yep.
So,
And for the adults, for the people in their 40s, 50s, 60s, so forth, we see a lot of arthritic type problems.
Yes.
And that's something that patients can see you about as well, correct?
Absolutely. I see a fair amount of patients who, like I said, have chronic either back, knee, shoulder pain, and aren't necessarily ready to talk about or ready to pursue surgery at this point. So we have lots of other, what I call more conservative measures. I refer a fair amount of people, like for physical therapy or occupational therapy, for typically 6 to 8 weeks at a time, and have seen a lot of success with that. Obviously, there's lots of medications that we can use to try to prevent advancement or kind of control those symptoms. And I also do joint injections as well, which can definitely put off the need for surgery for years sometimes if patients are lucky.
And as a provider, where do you see those patients?
So I see patients here in the hospital, basically off of the Willow Street entrance, the main health pavilion. If you go towards the right, I'm in the office with Dr. Whitsitt, Dr. Miller, and Dr. Weiss.
Yeah. And so you really work, kind of cohabitate with them in terms of you're sort of an entry point, a management for non-surgical type things, so non-surgical fractures, joint-based problems, sprains and strains as well. But also you have access to those providers if that escalates, or if you evaluate something and say, hey, this is not behaving as we would have anticipated it would, then you have access to those orthopedic doctors to escalate that care as well.
And I've seen that definitely throughout the 2 years. I've been working with sports performance for about 2 years now. So I have had clients who are like, let's try this conservative measure first. And sometimes, unfortunately, that doesn't work. And it's the perfect situation where I am in the office. And sometimes they're able to be seen that same day, or really very, very closely for follow-up by one of the surgeons if that needs to be the next step that's taken.
Sure. Now, one of the things that has been a hot topic over the past probably 5 or 6 years is concussion prevention, concussion management. And that's something back when I trained 22 years or so ago, we didn't really have a lot of data on. There was a lot of guessing. It was very much a gooey, gray, inexact science. And it's really come a long way since then. And so the schools that you guys are working with, that's one of the things that you offer in terms of management and evaluation for kind of the pre-screening and then post-injury concussion management. Can you guys speak a little bit about what that is and a little bit more of the science behind that now?
Sure. So we have a software that we're partnered with here through Good Sam. It's called Impact. We use that, like we said, with the schools that we're partnered with. In particular, this past year with Referral, we have their full service contract. So in the fall, we take a look at the sports roster and say, okay, these are all the kids who are participating in a fall sport. And we do the same for each season. And we say, have we seen this kid for what we call a baseline exam? So what it is like a 30 to 45 minute screening exam on the computer through this Impact software that tests things like memory, cognition, reaction time, and impulse control. So we use that as a baseline on all of our athletes. So that way, if and when they're injured, they can come back into the office, see me kind of for a full comprehensive exam, and then we have them retake that test to say, where are we at on the spectrum of this injury? Are they back to their baseline, performing where we would expect them to, or are they performing at a lower threshold where we need to say, we need to take a step back, we need to sit out and do a little bit of therapy before they are safe to return to a sport.
Yeah, I think coming from where we were before, which is athlete gets injured, comes off the field, hey, are you looking okay? Let's shine some lights in your eyes. You look good. We need you to get back out there. Really, as the provider, you're the calm head that's standing back and saying, hey, we need to evaluate you to make sure that if you re-enter athletics, you're not going to re-injure yourself or cause a greater problem. And unfortunately, some of the symptoms that go along with concussions are very vague. headache, dizziness, nausea, fatigue, light sensitivity, these types of things. And unfortunately, I think people don't appreciate it's not just, hey, my bell got rung and I feel better now, and let's run right back out and get back into the game. So there's all different grades of concussions, and so you all evaluate that, determine what the severity was of the original injury, but then what the recovery looks like. Because I think, unfortunately, what people don't realize is the recovery is more than just get off the field.
Absolutely.
Right? You tell us a little bit about what that looks like.
So the biggest thing I think that we push in recovery is what we call cognitive rest. So before, like you said, used to be the shine the flashlight in your eyes. If your eyes are reactive, you can get out there and play. Now we talk a lot about longevity. We know that that's not the best to return to sport right away. So sometimes that means months of therapy. Sometimes it's a couple weeks. And I think the biggest thing we found is that repeat injury leads to longer recovery. So I try to have that discussion with the patients and the parents to say, hey, this could be a lifelong issue if we don't address this and properly rest at this time. So like I said, we talked about cognitive rest, which is basically limiting kind of external stimuli. So we talk, about good sleep, good hydration, that sort of thing, managing the symptoms appropriately with medication, and then sometimes therapy in the long run, like for prolonged symptoms with headaches, dizziness, nausea, those sort of things. Sometimes that has to be addressed as well.
So rest is not necessarily get yourself back to school, get back to studying, go
Yep.
home and play video games.
Right.
It's not exactly the cognitive rest that you're talking about. So that's part of that recovery
Yes.
period also. So that's a really important service that has changed dramatically in medicine over the course of the past 5 to 10 years, is that we've got better science. We do understand that better. There are more systems nationwide that we understand that have been tested in actual athletic practice to determine when patients are safe to return. And again, the coach's job is to get that athlete back out on the field and compete. The parent's job is variable depending on how their role is in athletics, but our job is really to help be the objective bystander to clinically evaluate that person, determine when they're safe to return. Some of the other things that are offered through the service, I know there's a whole variety of other modalities beyond what we might call standard physical therapy that you guys offer. Can you talk a little bit about those? I know many of my family members have been attacked by the octopus and have been a dry needle, a variety of things.
Yes.
But can you talk about some of those other modalities?
Absolutely. So we're very hands-on as far as physical therapy, wellness, as far as that goes, to really treat musculoskeletal issues. For the most part, we're treating muscles. A lot of people refer to it as scraping. That is just instrument-assisted soft tissue mobilization.
Sounds nice.
Scraping's easier to say. I think it has a little bit of a negative connotation,
Sure.
but and so that's just helping, just basically getting the nervous system to calm down, allowing that muscle tissue to relax a little bit. You mentioned being attacked by the octopus. That is myofascial decompression or suction cupping, basically, bringing some good blood to the area, bringing good nutrients to the area, allowing the tissue to move through a good range and relax and loosen up a little bit. And then you also mentioned the dry needling. That's something that I myself and another one of our physical therapists, Gabby Hines, she's also a strength and conditioning coach and athletic trainer, but she is also certified in that dry needling. And what that does is basically takes tight muscle tissue. It's similar to an acupuncture needle, but as any physical therapist who dry needles is quick to tell you, no, we are not acupuncturists. But similar to an acupuncture needle, it's dry because nothing's being injected actively into the muscle. The needle goes into the muscle, oftentimes is then connected to electrical stimulation, which sounds scary, but it really isn't. Normally it feels really comfortable, and that stimulation just allows the muscle to contract and then eventually just fully relax out and hopefully solve that pain or issues that those patients are having.
Because sometimes the body makes a mistake and it sets itself up into this kind of never-ending cycle of spasm and pain and tightness and spasm and pain. And really those things that you're referring to, those other modalities, specifically address that.
Yes.
Whereas we talk about stretching, which is things we can do personally, and strengthening, things we can do personally. This is something that really requires somebody else to physically help with that corrective action. And I can tell you personally, with my experience with those things, is the nice thing is the results are relatively quick and satisfying. So whereas it's unsatisfying to have to wait for healing to occur, one of the things that I think is great about offering those types of modalities, this is something that patients walk in one condition and they walk out improved. And I think that's very encouraging.
Yeah, absolutely. We do some sort of pre-test, post-test, try to see if they're moving better, how their symptoms are. Absolutely. Our schedules are typically pretty flexible. You mentioned how getting that immediate relief. We try to have some type of, we can't always say we have it, we try to have some type of same day or next day treatment slots available, because we realize that if you want to get better. Also, an athlete, if they need to be back on the field, we need to get them in and get them treated as quickly as possible.
Yeah, absolutely. So as far as services are provided, I know a lot of people are concerned because nowadays many insurance plans have carve-outs where they don't cover physical therapy, or they don't cover certain services, or like many of us have, a very high deductible plans. So $2,500, $5,000, $10,000 deductibles. One of the wonderful things about the services that are offered through Sports Performance is this is something that can also be a cash pay type service. So can you talk a little bit about how that functions? Because I think a lot of people have trepidation about, I know physical therapy is going to be expensive. So what options do they have as far as the cash pay population or the uninsured population?
Sure, absolutely. So as I mentioned, there's kind of two different subsects there of the physical therapy. Insurance-based physical therapy, again, that does have to be built through your insurance, but I mentioned the wellness-based physical therapy. So that is something that's an out-of-pocket expense. You come in, we say cash-based, but you come in with your card, you pay with our scheduler. Those are $50 per visit. That's the same length as your typical physical therapy session. So however, up to an hour if you may need it, 30, 45 minutes, that's all dependent upon how the person presents. But again, very similar things. You mentioned those modalities, the dry needling, the cupping, the instrument-assisted soft tissue mobilization. Those things can all be provided to that patient, not having, as you mentioned, to go through that, unfortunately, expensive process of health insurance.
Sure. And then as far as other services you provide, Aaron, you wear several hats around this community, as I understand it, and we'll be practicing in another location. Tell us a little bit about what your different practices look like and who you see where.
So as of tomorrow, I'll be a full-time employee of Good Samaritan Physician Network. So I'll be seeing patients in family practice on Mondays, Mondays, Thursdays, and Fridays. So I may see a variety of orthopedic patients over there. But with Sports Performance, I operate on Wednesdays here out of the hospital. We set through the main health pavilion entrance. And then occasionally you may see me in the emergency department. I'll still be working there 1 week in a month.
Excellent. All right. So as far as kind of a general summary of what all we've done here, the biggest thing is that people need to understand that we have those services here locally. I think a lot of people sometimes don't understand that we have specific focused efforts at helping our athletes be better athletes, helping our athletes return back to their functional capacity, and then helping those of us who probably never were really good at athletes in the first place to maybe stay in a little bit better shape or prevent injury also. That's beyond just what physical therapy would be. And I think a lot of people may not understand that that's available right here. A lot of those extra modalities that you spoke of in terms of the dry needling, the cupping, the soft tissue mobilization are available right here through our program through Sports Performance as well. And then kind of the wonderful thing in terms of quick access to acute care and then comprehensive rehab is all available through that same facility. Summarizing also a bit about the concussion care, that's something that with you guys contracting with those local schools, with Reveille and Flagey, with Lincoln, and also with VU, that's a big population of our local athletes to make sure that we are doing the best things that we can to identify anybody who's had a significant injury and then get them fully rehabilitated so they don't risk that second injury, as you were talking about, that would potentially prolong that. We talked a bit about when sports physicals are, so coming up on the 14th. They can schedule that through Sports Performance, which the number for that again was
885-3011. And I believe there's 7 slots available. That was yesterday, last I heard. So.
Okay. So we would encourage everybody, please, if you have the need for sports physicals, pre-participation physicals, this is required before you show up for any part of participation. We would encourage you, get in to be seen, get your sports physical done, get your functional movement screen done, get in with your primary care provider, get in to be seen so that doesn't become a last minute thing, because it's about to become a last minute thing. School's coming up within the next month or two, and we want to make sure that people are evaluated for that as well. Any other things through your sports medicine program or through Sports Performance that we didn't touch on today?
I don't think so. Not off the top of my head, no.
Outstanding. Well, thank you all very much for being with us today. We appreciate all the information you've given. We have some questions coming through, perhaps, Clint?
Yes, we have one question. Do I need a physician referral to be seen for physical therapy services if I am having an issue?
Yeah. Aaron, you want to take that?
It may depend. It would definitely be worth a phone call to our office. Depending on the injury, we'd be happy to see you and evaluate you. But as Matt spoke to, if it's maybe not something that's going to take 4 to 6 weeks to rehabilitate, if it's something that may take 2 to 3 visits, the cash pay option might be a viable route as well.
So not so much a what needs to be done as much as a what insurance may ask or require. And so the nice thing is that the people that are in the front office of sports performance help patients navigate that as well. Is to say, hey, we can evaluate you right off the bat and then determine which pathway is going to probably make the most sense. If this is going to be a somewhat limited illness and recovery, or if this is something that is prolonged that maybe needs a longer therapy evaluation period, then that may be something that needs to be plugged in through insurance.
Yes, and yes, so oftentimes, to speak to that a little bit more, oftentimes patients come in, athletes come in, and they're like, we don't know if we need to do insurance, cash pay, so we take a look at them, decide from there. If they haven't seen Aaron or seen a provider, any physical therapist in Indiana, Indiana has direct access, which means that for 42 calendar days from the day we start the evaluation, we can see the patient without them having to go to their primary care provider and getting an updated script. Normally, there are a couple insurances that doesn't work with.
Sure.
But again, as you mentioned, that's something that our front office staff and us ourselves can help kind of navigate. So there are several different routes that patient could take.
Okay, great. Clint, any other questions today? Okay, very good. Well, thank you all very much for joining us. We'll be back with you again for Facebook Live in a couple of weeks. That'll be July 14th. I'll be back with our Chief Operating Officer and Pharmacist, Adam Thacker. We'll be giving you our usual COVID update. Between now and then, be safe over the holiday. Thank you.